So I'm Luis Obar. I working towards my public health major, and this is one of the projects has been like trying to figure out the time and everything. And you work in Stanford University, right?
Yes, I'm a postdoctoral scholar is my
Mhm.
official title, but I like calling myself a postdoctoral researcher because I think that's more informative at Stanford in the Department of Pediatrics, specifically in the Division of Adolescent Medicine at the REACH lab with Dr. Bonnie Halpern-Felscher.
Mhm. Right. So according to the Centers of Disease Control and Prevention, the CDC for short, uh, marijuana is the most commonly used federally illegal drug in the United States, right? 48 million people, or about 18% of Americans, use it, or at least used it once in 2019. Furthermore, younger people who are still growing uh, could develop marijuana use disorder early on in their lives. And one of my questions is, uh, what's what's more concerning to long-term effects of the user when they start using it at an early age?
Yeah, that's a really great question. And a lot of my research does look at adolescent substance use and specifically adolescent use of both tobacco and cannabis. So that's a really great question about cannabis use in general. Yes, you are totally right. We are seeing that so many adolescents, young adults, especially in the US, are using marijuana or cannabis. And what I would say is the biggest concern of all of this, aside from all of the health effects, the sort of negative effects to the lungs, substance use dependence, which you already mentioned, kind of in addition to that, kind of thinking more about adolescent development. I think adolescence is a really important time where people are learning, how to make decisions. They're entering sort of from adolescence to adulthood. They're making that transition. They're having to learn coping skills, um, other behavioral skills, and build that confidence. And if they are, you know, let's say going through a stressful time at school or some just like going through a stressful time, and if they're turning to substance use such as cannabis use or marijuana use, which is what a lot of adolescents cite as a reason, they're bored or they're stressed, and they want to relax, and they then use marijuana, instead of developing those skills of coping, of you know, um, learning how to manage stress without substances, they're just immediately turning to, you know, to
Mhm.
cannabis, marijuana, and they're not building those sort of like connections in their brain of, okay, like this is how I work through problems as an adolescent. They're kind of taking the shortcut. And then that later on in life, that, you'll see effects of that, um, where it does have sort of like poor mental health outcomes, poor academic outcomes, cognitive outcomes, etc. But it's that missing piece of like adolescents really need to use that time in their life to explore different things, to learn, to build healthy habits, to build those coping skills. And if they're using substances like marijuana instead to do that, they're missing that part of their developmental period.
All right. The other question was kind of like when collecting data from like all over the place. Like when you collect data, are there any methods in specific that you use to just get accurate information?
That's a really great question and a wonderful opportunity for me to plug my love for mixed methods research. So, I would say that research kind of generally falls into two buckets: quantitative and qualitative. So, quantitative data analysis is kind of what you would think, sort of your experiments, your randomized controlled trials, your surveys, collecting numbers, and sort of that type of information from participants. I'm also talking more in the world of like substance use and public health research too. The other half, there's qualitative research, which I think, which is growing much more kind of substantive in this field, but qualitative research is more like focus groups, interviews, photo voice projects. So things that don't come in numbers, but are data that can still be collected from people. And I think that the numbers and then the more kind of nuanced narratives of the quantitative and the qualitative research both provide their own strengths, their own nuances, their own detail that the others sometimes can't capture. So I always think that utilizing both of those methods in research projects, looking at especially adolescent substance use, is really important. And especially with the qualitative component too, you can really incorporate the voices of the community that your research is targeting or your research is looking at. So I always try to include like that adolescent voice or talking to school administrators and really understanding like what is going on in the community. And then that really bolsters then all of the quantitative survey kind of larger numbers kind of findings.
Mhm. Um, it's kind of a related question to it again, but
Okay.
how you distribute like the surveys or um, collect information? Do you just focus on one specific area, or how do you get uh, your? I'm sorry. How would you get your information?
Yeah. So that's a really great question. I could probably spend hours talking about different types of participant recruitment, so I won't get into that
All
boring
right.
nitty-gritty detail. But at least in my the work that I've done more recently, I mean, so one, there are national data sets or state level data sets that exist that you can just request access to. So it's data sets that have already collected data in the past, and you can take those and run secondary analyses on that. So that's one way that I've gotten data before to conduct some of my research studies and questions. Two, if I want to go out and get the data myself, quantitatively, so again, those surveys you mentioned, you can do sort of traditional recruitment methods where you go out into the community and kind of put your survey out there. There are lots, again, there are whole courses taught on this stuff. But one other popular method that I do want to say that I've been utilizing and seeing more and more of is online survey panels. So different companies, including Qualtrics, I've used Prodigy, just, online sort of marketing companies, they'll have survey panels where you can, pay a fee, which you would still have to pay your participants regardless, but you pay a fee and then they have their survey panel actually take your survey for you. So it's a really quick way to get data from sometimes a representative sample. So that's the quantitative side. Qualitative does take a little bit more networking and, like I said, making partnerships with the community, because you're actually asking individuals to interview or take part in focus groups. So it's like a bigger time commitment. And so that requires more partnering with, at least the work I do, like schools or school contacts, and having them reach out to their contacts. So I've had to do recruitment that way. Like for one of the for my dissertation, actually, like I partnered with the Massachusetts Parent Teacher Association, and I went to some of their meetings, and also the Massachusetts School Nurse Association, to try and have their members, work with, fill out one of our surveys and projects. And did a lot of like email outreach to individual school administrators to ask them if they wanted to be in our interviews, etc. I've so it's a lot more direct outreach and more like, sometimes we call it snowball recruitment or like referrals.
Mhm.
Yeah.
Right. Uh, so then the next question is about when you do have all this information, qualities, and other outcomes, how do you work towards a kind of like goal to improve any negative or concerning outlooks?
Yeah. So I would almost say like it happens in the reverse. I usually have like, a research question in mind that's addressing adolescent substance use problem. And then from there, I'm like, okay, like, let's say I want to do a study understanding, the negative impact of, Instagram ads about cannabis and adolescent substance use. And I think that, I have a hypothesis that like more exposure to these Instagram ads is going to lead to like more substance use among youth, something like that. Let's say I have this issue or this question, and then I'll be like, okay, what data do I have available that might, is there a national data set that's already collecting this information? Or if not, then okay, how can I then design a study? Do I want to do a survey? Do I want to interview adolescents? Usually it's both. So I would say that the research question or the problem actually comes first. And then I go there to then think about, okay, like what is feasible? Like what can I do? What is like novel that I can do to answer that question?
Mhm. What's like the process of like making a research question? Or
Uh, just like the process of coming up with a research
yeah,
question.
yeah, from the data you collect.
Yeah. So I mean, I obviously sort of have my area of interest, which is, understanding risk and protective factors of adolescent substance use, understanding their use patterns, understand like I kind of come in already a little bit with like, okay, this is what the areas of like kind of based on what I've also seen in the literature and what other researchers are working on. This is what's kind of still needed in my field. So I kind of come in with that. So yeah, part of it is your own interest. Another part is, okay, what kind of studies have already been done by other people and what still where's the research gap? Like what still needs to be done? And that's where you can fill it in. And um, then the next thing is like kind of figuring out, okay, what exactly specifically you want to focus on, because your research question can't just be like, why is social media important? That's too vague, like that's too broad, like research questions do need a level of specificity. Okay, like what is it about social media? Like what is it about the substance use? Like what is it about adolescence like that you really want to focus on in the research question? And that can be the hardest part sometimes, is thinking about that piece. And for me, like I always tell this to people, like my best ideas come when I'm either in the shower or just going on a walk. Sometimes these ideas will just come to like, oh yeah, or I'm like watching TV and something about like cannabis just comes up because it's TV, and then I'm
Mhm.
like, oh wait, that could be a good research question. And so I have this just like running note on my phone of like possible research questions, so that when I am like in the shower or on a run or getting groceries and I'm like, ooh, that would be a good idea, then I write it down. And then, obviously when I'm in a different headspace and like actually looking at my data or sitting down in front of my computer, I'm like, okay, was that idea realistic or was it just like a fun passing thought? And some of those passing thoughts turn into, research projects, et cetera. So
That's cool. Um, how do you observe health disparities and when do like they become a major concern?
again, going back to the quantitative versus the qualitative. So qualitative research, another really important thing is to make sure that you're recruiting diverse participants, especially when it's for, when they're telling their story, they're telling their narrative. And that's one way to really capture the voice of some of these participants who are experiencing kind of more or less substance use based on belonging to a certain group or not, and capturing those different identities and values in a qualitative way. And then I'll just add to that too, another kind of important aspect of especially some of the work I'm going to be moving more into is doing community-based participatory research. So actually having people from diverse backgrounds serve as almost an advisory board for your research projects and your studies. And they're there to inform you every step of the way to make sure that your research is being appropriate for, all groups, all parts of the community, all participants that you're including in your study, and that it's relevant, it's age appropriate, it's culturally relevant, etc.
Mm.
Yeah.
What have you like done anything like engaging in communities?
Yeah, so like I mentioned, I really want to work in the school intervention space.
Mm,
So I've for one of my projects I did during my doctoral, for my doctoral dissertation, I actually collected data from school administrators about substance use going on their campuses. And for that, like I already mentioned, I partnered with the Massachusetts Parent Teacher Association. I went to their meetings. I met with various people from other school organizations in Massachusetts and formed relationships with them. So that was one way I have. That was all done virtually though, during COVID. So it's possible to still build those connections in a virtual way. And then more of what I'm doing now, as I just started my postdoc a couple months ago, I've been giving a lot of talks to different school communities. So like I gave a talk over the summer to a group of like athletics directors. I a couple weeks ago gave a talk to some parents in a county in California, just talking about sort of substance use, e-cigarette use among students, etc. So doing sort of direct outreach, also giving talks. And then in my, I just put in a grant application where I will be hoping to work directly with youth and creating that sort of what I mentioned, like a youth advisory board to inform my work, and then doing qualitative and quantitative methods to understand adolescent co-use of tobacco and cannabis.
mm. How important are connections in this field? Like throughout your career, how many people do you have to go to for certain information or um, specific work, kind of?
Yeah, so I would say that connections are really important, both sort of in my career and also in conducting my research. So in my career, obviously, like I've had to connect with mentors, professors, etc., and that has helped me along academically. So I don't know if that's what you're asking for, but also in terms of connections, like none of my research would be really possible if there were no connections with the community. And I feel like like I guess I could keep doing secondary data analyses my whole life and get a lot of, and still probably be, you know, fine as a researcher that way. But for me, I really want my work to impact schools, students, parents, families. And to do that, I do need to involve community stakeholders throughout my research project. And that's why I enjoy going out and giving these talks to parents, athletics directors, educators, because I'm hearing what they need. And that's making my research questions that I think about more relevant to them. And then it's sort of like this back and forth. You're doing research with the community, not for or to the community. So I think having those connections is really important, especially as a public health research specifically, because you can't just hide behind your computer or hide behind okay, I'm not using the word hide. You can't just stay behind a computer or stay behind your lab, cell petri dishes. The work that we do is helping the population. And I think part of that equation does mean, the stronger connections that you are able to make with the community, the better your research outcomes will be, and the more impactful, which is, I think, what we all want our research to do.
Mhm.
Yeah.
Um, what are some obstacles you come across when trying to um, like work with other organizations or work with other people?
That is a great question. And at first I was like, oh, that's a tough one. I'm like, no, just kidding. I know this answer very quickly. It's time. Everyone is really busy. And although I study adolescent substance use, and I think that it's the most important thing everyone should be thinking about, I mean, there's other important things, obviously, but a school administrator probably thinks that adolescent substance use is very important, but they also have like 5,000 other competing interests, and fires to put out or like things to address at their school. And substance use is just one among many of those things. And I think that's the biggest difficulty is, the acknowledging that like people have a limited amount of time and bandwidth, and everyone no one disagrees that substance use is an issue, but it's like being able to find the time, the space, the educators, the people who are willing to kind of do that work that needs to be done can be hard. And it's not any individual or any school or anyone's fault. It's just like there's just so much going on, and it's like, how do you prioritize that? And we can only do our best, and try to make things as easy as possible for other people. But then, everyone, like I said, time is limited for everyone. So,
Mm.
and
Right.
funding resources, like not all schools have like a ton of, yeah, again, to pay the educators or to get the resources needed. um and that's a huge thing. So I'm always plugging, like, again, there's limited budgets in each state, or just in general, like schools just, they need more money to be able to have mental health resources, substance use counselors, like educators, etc.,
Mm.
um available for students. So that's a huge problem too.
Mm. Uh, Going back a little on cannabis in adolescence, you said you were interested in building a school-based program for adolescents about tobacco and cannabis use. What can be done to like encourage better choices uh, than to taking these substances or other substances?
That's a really great question. I don't know if I have the answer to that yet. That's what my
Uh,
research is currently hoping to do. So yeah, you're basically yeah, my project that I hope to work on as a postdoc and in my early career is really understanding that nuance of the patterns between adolescent use of cannabis and tobacco. And I hope to, really work towards the field of integrating more and more of these different kind of, like, there's a lot of curriculum and there's a lot of resources out there, and they all kind of like tack like tackle one thing and then another thing, and it's like, how can we bring that all together? Because adolescents aren't just only using cannabis or only using tobacco, they're using everything. um and so that's what my current research is looking at, to better understand those patterns, those motivators, like why they're using things, and then using that information from my research to then inform the design of future interventions. And I've done a lot of work already around sort of like best practices. So yeah, creating things that are interactive, engaging for adolescents, not just, lectures or books, creating material, and co-creating it with adolescents and teachers and educators too, I think are all going to be really important when it comes to creating really impactful and engaging interventions and curriculums in the future.
all right. Uh, so a little bit on a different topic is the public health essential services, 10 public health essential services. So a little bit on the third essential service is what works to best communicate to the public to encourage them to like reach out for information.
You're asking for my opinion on that?
Yeah.
Ooh, I don't know. I'm not a communications person. So um, I I would just say that in terms of like thinking about adolescent substance use and school-based interventions, I can kind of talk about it in that lens. I think one, it's just really, really important to give knowledge or to educate adolescents about, the truth of these substances, um, and then make available like different resources and avenues, just making all of this information just available, and giving it to adolescents, teachers, parents, etc., having that full free access. Like, I think that sounds so simple and kind of like, oh, that's kind of an obvious thing, but I think it's actually not being like as obvious and being used as obviously everywhere. Um, so I think just really communicating about the harms of like these substances, tobacco, cannabis, etc., so that adolescents know what they're putting into their bodies when they're using it. That's like the first step. And then encouraging them to, with the right resources. I mean, ideally, they can be learning these in school-based settings, directly from educators that they trust. But, more and more there's things around media literacy. So training adolescents how to, like, when they look at stuff online, like what is actually a reputable source versus not. I know that's a big thing right now with just all the social media and how anyone can post anything on social media. So adolescents are having to, sift through that and figure out what's true and not. And exactly. So it's tough. I'm not a health communications person, but I am a health education proponent of, definitely, one big step is just educating people on the true harms of these products and substances.
Uh, and then this one kind of ties into the last one, is essential service number 10 is what ensures that your goal is prolonged to keep going strong for those in the future.
I always say this, I hope I'm not going to be studying like adolescent vaping forever, or adolescent cannabis use forever, because it means that it's gonna be a problem for a while. But hopefully, like, we start to see great public health improvements in this field. But knowing that, there will always be new substances, new products that emerge and become popular again among adolescents, all I have to say is that we continue to keep our research up to date with these new products, these new emerging products that become popular among adolescents much more quickly than we think, and then conducting that evidence-based research, and then using that evidence-based research to then design better policies and better interventions that help prevent and reduce substance use among adolescents. I think that is the important thing to keep in mind.
Just a question to wrap it all up. What is your drive personally to be working in this field?
Yeah, so I think I've always been really interested in sort of like understanding adolescent and young adult health throughout my whole life. I was um, a tutor. In high school, like, I don't know, I just really cared about like my school environment. In college, I was a orientation counselor, so again, kind of being that peer-to-peer, like, I just really cared about like sort of the health and well-being always of my school and my campus, etc. So that's one part of it. And I think another part of it too is, I'm a first generation college student. My parents are from Taiwan, and coming to the US, or I was born here, but, kind of growing up in a family and community where, you do see substance use happening, especially tobacco use. That was definitely something in the back of my mind. Okay, substance use isn't good. I've kind of seen it in my kind of immediate environments. And then kind of seeing it even more on a school setting, kind of all came together. And then when I went to do my master's in public health internship, that happened to be the same summer that Juul really skyrocketed in popularity in 2018. So I was kind of in like the right place at the right time, and really started learning more about public health research that summer. And that pulled me into the field of, okay, like combining all of my previous passions and interests in substance use, adolescent health, student health, campus health, et cetera, all together. And then motivated me to pursue a PhD and a career in public health research, specifically in this field. And I just really care. I mean, it's a huge issue. Like so many, like I think I was like looking at one of my data sets, and it was like, oh, like almost 50% of adolescents have ever used alcohol or like ever used some kind of tobacco product or and e-cigarettes. And I was like, oh my God, over half? Like that's so many. Like, and I think it's just like the sheer prevalence of this issue is another reason why, and just knowing the negative health outcomes and mental health outcomes that it may cause. I really want to do everything I can to prevent this among adolescents. Because again, like in the very first question you asked me, adolescence is such an important time. And I really want to be doing work that is helping move adolescents towards making better, healthy decisions during that time period.
I like that. It's really nice. It's kind of like what I want to try to do, but gotta work towards it right now.
Yeah, no, it's great. What do you want to do with your I know you're doing this for your public health course, but or your minor or your major. So what what do you hope to do with your with public health in the future?
I kind of just hope to help like younger generations have a good lifestyle and just help others along the way or help improve current situations in a more larger scale as much as I can. But overall, just helping others
Yeah.
is what I'm going towards. But
Well, you're
like
in the right place for that. I have to say, that's all our field does is helping others. So you have found your field, I think, and it's great that you have that passion of wanting to help others. That's sad to say, not necessarily the main driver of most people when they're choosing their careers. So just know that, whatever you do from here, you'll be making you'll be doing one or way more of those essential public health services in your career. So that's great to hear. And I hope that you learned something, that I was able to share something useful and insightful for you today.
very, very much so. It was
You asked great questions. Even I learned something. I reminded myself what exactly the essential public health services were. So thank you for teaching me something on this call too.
for sure.
Yeah.
Well, I thank you for your time. I really appreciate it. Was Thank
Yeah,
you, and thank you for making time for this meeting
of
as well.
course. Of course. I had so much fun. This was a great conversation. It reminds me of why I also love doing the work that I do. So thank you for having me again. So happy that you reached out. And I'm always here if you have any follow-up questions or need anything else, please don't hesitate to reach out.